Hi, I'm Dr. Sandifer at Champion Chiropractic Center. I've been asked to do some stretching videos that I teach in our office. So this is our cervical series, the 6 stretches in 3 planes. So flexibility is important. After you get your past 30, you'll get some stiffness, some aches, some pains. Flexibility will decrease injuries also. Another reason of why to do stretching is we want to take and help our muscles get back to their normal length that they should be on there. Motor units need to come back to stretch. Alright, we're going to concentrate on these 6 stretches in 3 planes for the neck. First one, a plane is a direction. This one's going to go forward and back. So, Serena, I want you to go ahead and do a forward stretch for me. So chin down, there you go. It's stretching the back all the way down here. Feel that? Good. She's going to hold there for about 20-30 seconds. Some slight pressure on that. Alright. Once you come on back up, good. And then go the opposite. There you go. Nice job. And that's going to stretch the front part of the neck here. Now the reason why we do stretches is to help flexibility, decrease tension, stress in our lives, such like that. Come on back. There you go. Alright, so she's going to do a side movement now. This is the second plane. Right ear, right shoulder. Now it's going to stretch right here. And those of you that do computer and texting, this is a real important one. The reason for that is that come on back up, and we're going to show them. If you're in center, then you're going to be doing better. But when you're in a texting, right, then it puts stress and strain on the back and side here, and that'll tighten up for you, right? So there's muscles that come right down here too. So on this side stretch, I'll give you a little bit of a variation on this. So you start with the ear to the shoulder, and you get this muscle group right here. If you take and go forward with the chin, then you stretch this one right back here, and that's a really nice. You feel that, Serena? Yeah, exactly. If you want to help out a little bit more, you kind of put the hand out and just let it. There you go. Is that more tension there? Yeah, there you go. And then come on back up. Good. So that's going to stretch more on the back side when your chin goes forward. So we're going to do it to where it stretches the front part of the muscle. We're going to go ear to the shoulder and then chin up. There it is. Do you feel that front part there? If not, reposition about right in there. Are you feeling that?
Better.
If you want a little bit more, then you just push that on out. It's like you're pushing away from. There you go. Nice. Good. Come on back up. Alright, so that's the right side. You're going to do the same thing on the left side. Left ear, left shoulder. There you go. Great. Nice job. You feel that right there?
Yeah.
Okay, so let's get the one right back here and go forward. There you go. Nice job. You put your arm out and there you go. Nice job. Good. Come on back up. Alright, there you go. Good. Alright, so the next plane is going to be rotation, and that's or twist. And so we're going to leave the shoulders where they are, and we're going to look over to there you go, and you're going to hold, relax, there you go, and then a little bit more, there it is, good job, good job. So she'll hang for 20-30 seconds, we're going through it kind of quick here, and we'll go this side, there you go. She's more flexible in her left than she is the right, so it's important to do the stretches to balance back out. Alright, come on back. So flexibility is important. When we get past age 30, which she's not there, but as we get past age 30, we get more stiffness, aches, and pains, and we know that if we stretch, we get more flexible, which will decrease the potential of injuries. So, like that. 20-30 second hold, slight pressure. Those of you that are acute in pain on there should do it 3 times a day. Breakfast, lunch, dinner. And then maintenance is more of 1 time per day. So if everybody can stretch 1 time a day, I'll do the cervical right now. I'm going to do thoracic and lumbopelvic after this. And we'll take and work together to be flexible and move well, eat well, and think well. Hi, I'm Dr. Steven Sandifer with Champion Chiropractic Center and Clinical Nutrition. I'm here today to talk about stretches in the mid-back. And we're going to do the 6 stretches in the 3 planes, just like you did in the cervical series. So this is the mid-back. Those of you who are doing computer work and texting can be helped out a lot by these stretches. So first one we're going to do is a forward and back. And I put Serena in the chair here so that she can touch the floor on there. So you can do this in a variety of postures, but right now we're going to do it in the seated. We'll do standing also. So we're going to take and do a forward stretch. So your hands are going to touch the floor. Tuck the chin for me down. There you go. See, all along here should be, go ahead and tuck the head down a little bit. There it is, right there. You should feel all up and down the spine here. Nice job. 20-30 second holds there. And then she's going to come on back up. Why don't you come on back up? All right. Extension, going the opposite way seated, is going to be leaning back. There you go. And up. There you go. Nice job. All right. Do you feel that stretch?
Yeah.
Good, okay. And then come on back up. All right. Nice job. That's the plane of forward and back. Now we're going to go a plane on the side, but the side stretches for the mid-back are best done standing. Go ahead and stand for me now. Okay, so what we're going to do is use the seam of the pants. We're going to run the hand down the seam of the pants on that, and we're going to lift up and touch towards the sky. She's 20 and she's flexible. But do the best you can on there. It's this movement right there. There you go. Nice job. And then we're going to go opposite way. Good job. All right. So that's the right and left lean. And of course she would be there for 20 to 30 seconds. Now the next one's going to be rotation or a twist. And I like where you have a good base on there. And you can twist just at the spine with the shoulder. Or you can take and get the whole shoulders in there with the neck and everything. Look around. There you go. Nice job. See how the difference that was? Okay, good job. And we're going to come back this way. She likes the spinal stretch there. And then show them the variety of all the way through the shoulder. There you go. Good job. And you're looking back. Nice job.
Thank you.
Good. All right. So I'm Dr. Steven Sandifer with Champion Chiropractic Clinic. This is the thoracic series that you should be doing. Acute is 3 times per day, breakfast, lunch, dinner. Maintenance care is 1 time per day. Another stretch we're going to show you is called the seated elbow stretch. Now this is going to open up the chest. Because we go forward and things tighten up, we have to go opposite. So this is the elbow seated elbows stretch. Elbows together. There you go, sitting up. There you go. As far as your elbows can come to. There you go. Now you're feeling it. Right there. Good job. So that's going to open up the chest and the pelvis. All right, so I'm going to show you from the side here. Trying to look forward for me. There you go. Trying to get the elbows close. It's going to stretch the pecs, which tighten up the pec minor in particular. Okay, this stretches for the pecs again. It's just a variation of the elbows seated. We're going to take and do a doorway stretch. So if Serena comes on in, go ahead and put the elbow up. Good. Step with the same foot through. There you go. Nice job. Good. And you can see right along here, this is what she's doing. To get a little bit more stretch, she can turn her pelvis just a little. There you go. Huh?
Yeah.
Yes. Right there. Good job. Okay. And then you're going to take and let that down. And you're going to turn and look that way. This one through the door. There you go. And you can go further through the doorway if you need to with that. There you go. Perfect. That's good posture in there. Nice. And that's going to help to get from a slumping to an upright looking forward so that you can be level and plumb. Hi, I'm Dr. Steven Sandifer with Champion Chiropractic Center and Clinical Nutrition. Here today to talk about the 6 stretches in the 3 planes. This is the low back series. So the first one we're going to do, as you have seen with the others, is a plane, and the first plane is going to be the forward and back stretching on there. So we're going to do forward. We're going to start in the chair, and we're going to go forward like you're going to touch the floor. Good. Concentrating on the lower back. Now before we had to tuck the chin, that was more the upper back, but right now we're not concentrating on upper back, we're concentrating on lower back. So she's doing a forward stretch there. Good job. Okay. And the backward stretch, we're going to put her, keep her in the seated position on there, and then you're going to do an extension back. Good. Now we're going to show variation on this extension back because, go ahead and stand for me, Serena, because you can do it in different positions, postures on there. One of the best postures we can do for the back, because it's very unstable and it's shaky on there, is try to steady yourself a little bit. Put your hands on each side and then go back, gentle, and then there's your stretch there. One of the things, if you take and look up, you're going to finish the stretch. Good job. All right, another variation on this is actually laying down. So Serena, I'm going to bring you over to the table and go face down for me. There you go. Good. All right, so what we're going to have you do is that backwards motion. You're going to put your hands either there or on the side of the table here. Good, and you're going to come up. There you go. Gentle. She's very flexible. She's 20-something young, right? And those of us that are 30s, 40s, 50s, and 60s probably aren't going to get to this posture. But that's okay. Just do it at your ability. So as long as you understand a plane, the forward and back movement, you can take and figure out which posture position is going to be your best. Alright, so then that's the forward and back plane. We're going to do the side plane now, and the side stretches, hand down on the side, and the other one up in the, there you go. Now you're doing your side lean stretch on there, concentrating lower back. Good job. Come on back the other way. There you go. Good job. Now you can do this seated too, in the seated position, just down on the side here and up like this. It's the same movement as we're doing. And you can decide which one your ability is going to allow you to do. Alright, so rotation. We're going to do it standing and rotation in the lower back. There you go. She's showing you the standing one. Go ahead and switch to the other side. There you go. Good job. And I'll show you the one that's lying down. So we're going to be on our back, knees bent, shoulders kept down, and we're going to rotate at the low back. This is the one that I do before I go play racquetball. Over. So that's rotation. While we're sitting, we can do one just like this too. Now this is like the forward lean. It's the same mechanics. It doesn't matter whether you have your head down or up. Either way, up's going to give you a little bit more pull tension right down the lower back. Go ahead and put your feet down. There you go. There you go. when you stretch, you should kind of relax with it and allow the tissue to elongate. There you go. Back the other way. Go ahead, just drop. There you go. Nice job. Putting that rotation in that lower back. Good job. All right, and this is the one. Yeah, we're going to bring her back just a little bit more. There it is. Good. Nice. Okay, so that takes and finishes up the 6 stretches in the 3 planes. Now we're going to put a couple others for the hips now. So we're going to do the seated hip stretch. Go ahead and sit. All right, she's going to figure 4 in the seated position. Good. When she's there, she's going to try to sit up straight. And not so much movement in the lumbar spine. We're going to keep that straight, but most of the movement at the hip so that you can get right at the cheek, the butt cheek there. Good job. Are you feeling that? Yeah, but you are. It's a good one. All right. Good, and then hold. Nice job. All right, come back. Now switch. And put that one down, this one up. Good. Sit up straight. There you go. And you're moving so that you're getting the glute muscle back there. Good. And if you take and move the chin down just a little bit more, do you see how that tightens that up too? You finish your stretch with the neck. Good job. Okay, so that's the back part of the hip muscles, but there's also front muscles of the hip too. So we're going to take and do a psoas hip flexor stretch. And we're going to put you kneeling down. All right, so when you're doing this, this is unstable. Hold on to something, okay? A chair. Good, go ahead and look forward. All right. Okay, very good. She's very flexible in her hip flexors. Most of you aren't going to get that way on there. I'll show you with me, and and then go ahead and change and come up. She's down on one knee, 1 foot forward. It's a lunge. There you go. All right, that's good. Nice job. All right, let me show you the more than double age. So I can't get all the way down there, but this is my hip flexor in there. And some are going to be just about right here and feel it. That's okay. You do what your body will allow you to do. Okay, so that's your hip flexor and extensor stretching. And thank you for watching today.